The number of undetectable cancers out there is greater than the number of cancers that we diagnose, because if you think about the 5 to 7 year lead time, which is a truism we're not sure of, but if they're there 5 to 7 years before we find them, then they're hovering down here undetectable by mammography. It used to be we only found them by palpation, and of course mammography ushered in an entirely new era, an exciting era, finding cancer earlier, saving lives. However, I'm not a radiologist, and what I found was that radiologists were more enamored with mammography than I was. And the reason was that as a surgeon, I saw the women whose cancers did not show up on mammography. And I wondered, this isn't perfect. We shouldn't be patting ourselves on the back when we have a modality that we're promoting so heavily and it's not perfect. In fact, the studies that show that mammography misses 10-15% of cancers are talking about cancers that ought to be detected are not showing up. They're talking about cancers that are large enough to be seen, but they're not seen. And a typical study will count women whose cancer appears within 6 to 12 months of the mammogram. Well, that's the women up here and just barely below the threshold whose tumors appear very quickly that they're talking about. They're not even talking about these tumors that are too small to be detected by mammography under any circumstance. So one of the things I'm going to be talking about today are new methods to detect breast cancer all the way down so that our threshold is lowered to here and we can see cancer for the first time with new modalities at this much earlier stage and really make even a bigger